and I think it's appropriate that it should be called actually the Wuhan CCP virus. And the result is a worldwide pandemic as a result of the neglect of the Chinese Communist Party and its propaganda wing, the World Health Organization.
Hey, welcome to Unlatched Mind. My guest today is Dr. Jeff Barke. Dr. Barke is a board-certified family medicine physician with a practice in the Newport Beach, California area. I found Dr. Barke from a video that had gone viral. I originally found it on Facebook. I think Facebook pulled it. I think it's still up on YouTube. I'll post a link to it. I think YouTube still has it up. I haven't checked in a while, but so anyway, Dr. Barke is pretty much standing in front of the crowd at the protest and demanding that the local officials open the economy back up and get things moving. And he walks through a series of points where he questions what we've been hearing, right, from the media. In other words, what if wearing a mask in public is really not that effective? Or, why are we actually quarantining the healthy in this case? So let's just jump in. Dr. Jeff Barke. Dr. Barke, I really appreciate your time. I know you're super busy. I guess let's start with, I found you, you had a few videos that went viral. Now, I don't remember the details of where that one was. Was that outside that very first one where you were kind of questioning, you were going through the what if masks aren't as effective as they say, and you went down this huge list of, kind of, I would say, challenging the status quo that we've been hearing from the media. Was that outside
right.
Where was that?
That was in Riverside. My wife and I were invited to attend a rally in Riverside. It was prior to the Riverside the Riverside Board of Supervisors meeting where they were going to vote to open up the county of Riverside. And we were invited to come out, and then somebody asked me to speak. My wife decided to videotape it and then later loaded that video onto Facebook, and millions of views later, I'm getting calls from the famous Vinny to do a podcast.
You must have me confused with somebody else, but yeah. So now, as a result of that, I heard you do a few interviews, and you've been attacked for that, both personally and obviously, attacking ideas, which is what we're supposed to do. But I think you've been sort of attacked personally since that whole thing, haven't you?
I have been, and that's the part that has been really enlightening and disturbing. It's not that people disagree with my ideas.
Right.
I can support my ideas, and I even learn from disagreement. But it's that they attack me personally, not just attack my ideas. And then not just attack me, but they bring my wife into it. They bring my kids into it. Mm-hmm. They make threats like, we're going to call the medical board because you should lose your license. Somebody called my medical office saying, I hope the entire office gets COVID-19 and that you all die so you stop speaking. It's things like that you just go, seriously? It's just, there's crazy people out there.
Yeah. Yeah. Okay. Yeah, it's amazing they have a voice, but that's how it works. But obviously they don't want you to have a voice. But yeah, well, I want to get to the rioting thing later, but it's the same kind of thing I think where people have basically an opposition to an idea, and then they take it to such an extreme it becomes complete lunacy. And anyway, we'll get there. But so, I guess overall, what has been your beef with how we've handled this crisis from the beginning? I know you have some details, but overall, what do you think? What are we doing wrong? What have we done wrong?
I think there's several things. First and most importantly, we've overreacted, and we've overreacted based on fear. So there's a lot of things that we never should have done, and things that we were promised that we did, but then the promise was taken away. So, for example, we never should have closed down the schools. If you believe in the idea of herd immunity, and I do, and by the way, there are a lot of epidemiologists, renowned epidemiologists, that believe in the concept of herd immunity, and we can talk about what that means. Their voices are shut down because it doesn't play into the mainstream narrative. So if herd immunity is true, and the only way ultimately we get over this virus is to get enough people exposed to it where the virus can't spread rapidly to those that are most endangered and those that are most vulnerable, that we never should have shut down the schools. You know, in Orange County, California, which is where I live and practice medicine, you can count the number of deaths from children on one hand. Actually, you don't even need a hand because the number of deaths has been exactly 0. And across the country, the number of deaths in children have been only 20. So this virus does not affect children very much at all. There's been a lot of articles about it. I've written it as well, that the risk of a child dying in a car accident is greater than the risk of COVID-19. And a child has a 50-time greater risk of dying from drowning than they do from dying of COVID-19. But we don't shut down swimming pools. But what we did do is we shut down our entire nation's school system. I think that was a big mistake. And the reason why it was a big mistake is because it delayed the ability of children and young and healthy adults to get exposed, to get immunity to this, and then ultimately protect those that are most vulnerable. I'm sure you've read the statistics, but almost 50% of all the deaths in the United States have occurred in nursing home patients and those that live in these extended care facilities. And those are the folks we need to protect, not the children, not the young and the healthy. 98.6% of people, when they get this virus, are going to have either no symptoms or very mild symptoms. So we need to stop acting from a place of panic and fear, and we need to use a little bit of common sense how we move forward.
I mean, yeah. So what do you think is different about this one? Why this one? Was it? Now, I guess if we take a step back, flattening the curve. I mean, would you agree that we at least had to flatten the curve initially to keep from the healthcare systems from overrunning the healthcare systems?
The concept made sense in the New York area. The healthcare system there temporarily was overwhelmed. A little bit in New Jersey, for a time in Seattle. So the idea was, oh my goodness, the healthcare system of the United States of America is going to be overwhelmed. We're going to see people in the streets on stretchers. We're not going to have room to take care of all the ill. So we need to flatten the curve, shut down the economy, keep kids home, and so forth. For a brief time, that made sense. But we soon learned that the exaggeration of Governor Cuomo, that we need hundreds of thousands of ventilators, and that the healthcare system, even in New York, was going to be overwhelmed. It was temporary at best, and it was never as bad as the fear-mongering that was done by the governor. So we know now today there was not one single patient anywhere in the country that was denied a ventilator when they needed one. And so that was a temporary fear-mongering concern, and it never came to fruition. And then even after we realized that the healthcare system was doing just fine, we continued to keep the country closed down. And the consequences of that have been devastating. The consequences of shutting down the economy, 30 million Americans unemployed, suicide rate at the highest we've seen since the Great Depression, missed diagnosis and delayed treatments for medical illnesses all over the country. We're seeing more harm from the shutdown than we're seeing from the virus itself.
Yeah, I mean, that's been so. I mean, that's pretty much been a talking point of folks on the conservative side, on the right, since the beginning, and it's obvious that there's certain economic realities that are taking place that are just many of which are going to be unrecoverable for a while. Now, so what do you think? I mean, I always say this in pretty much all my podcasts. Pretty much everything gets political. I try to stay apolitical, but it's almost impossible. But you use terms like fear mongering, things like that. To what end? Why would? What do you really think? Do you believe there's a larger scale, left wing type liberal, push? And this is what I've heard, so that's why I'm going to ask you. That wants the government overreach, because government overreach will then, pretty much chip away at the civil liberties, requiring, based on fear, right? And this is how it's happening, and historically, right? You can look at, I think some of that history, and so the government overreaches, chips away at civil liberties. Then businesses go. A lot of businesses have to close down. What do they now? They need more government subsidies, so the government grows. More dependency on the government. It seems to be a conspiracy theory in a sense, but do you think there's some truth there? Do you have some belief that that's something that's not too far-fetched?
Well, listen, Vinny, I listened to your podcast, as I told you earlier, with the professor at the University of Miami, who interestingly specializes in conspiracy theories.
Yeah.
And just for fun, I looked up what is the cost of sending a kid to the University of Miami, and it's about $50,000 a year. And so I wonder, first of all, how many parents realize that they're paying $50,000 a year so a kid can enroll in a class to learn about conspiracy theories. So that's just kind of an interesting aside. But the professor mentioned some ideas that he described as conspiracy theory, and I just don't buy it. Label something conspiracy theory, and immediately you're considered a nutter. So, for example, he talked about, well, is it true that this virus was propagated by the Chinese Communist Party, either developed in a lab or purposely spread? I don't want to put motivations on anything that anybody does. I just want to look at the facts. And the facts and the reality of the situation are that there's information that shows that the Chinese Communist Party knew about this virus as early as the end of November and certainly into December. And along the same time, the World Health Organization acted as its propaganda wing and continued the narrative that this virus doesn't spread person to person. This virus is only found in animals, that we have nothing to worry about. Yet at the same time, the Chinese government shut down flights internally from Wuhan to other areas in China, but never shut down flights from Wuhan to the rest of the world until President Trump finally took the courage and leadership to say, there's something crazy going on here, and we're going to shut down flights that are coming into the United States from China for a while until we figure out what's going on. So this isn't conspiracy theory information. This is the reality of the Chinese Communist Party. Now, whether they did this because they were embarrassed and trying to save face, or whether they did this simply because they wanted the rest of the world to be affected as they were being affected by this virus, I don't know. But the reality is this virus came from China, and I think it's appropriate that it should be called actually the Wuhan CCP virus. And the result is a worldwide pandemic as a result of the neglect of the Chinese Communist Party and its propaganda wing, the World Health Organization. And so that's not conspiracy theory stuff. That's just the reality of the situation. When you're dealing with a communist party and expecting them to treat you fairly, this is what you end up with.
Now, all that could be true even if the virus was not intentionally created, correct? I think if I remember right, the conversation was he was calling that a conspiracy theory, that the fact that it was intentionally created and leaked out of a lab. Because everything you just articulated could very well be the case, even with an accidental transmission from a bat to a human, correct? Now the cover up and all that,
that's
all
correct.
Yeah.
I'm not suggesting this virus was intentionally created in a weapons lab. I don't know that to be the case. I've read some of those theories about the DNA sequence in the virus, that it couldn't come naturally and this, that, and the other. Regardless of whether that's true or not, the reality is it is true that it came from Wuhan.
Yeah,
it is
sure.
true that the Chinese Communist Party covered this up. It is true that for a time the World Health Organization mimicked the talking points of the Chinese Communist Party. And it is true that the Chinese government continued to allow flights from Wuhan all over the world, while internally they shut down flights from Wuhan to the rest of China. That all is indisputable and true.
Mm-hmm. Now, in terms of the numbers, that's another thing. I've read this and I've talked to actual healthcare officials that have kind of confirmed this. They didn't want to go too much details, but basically, the numbers here also could be inflated, correct? Because are hospitals / doctors incentivized to say, hey, this patient died from COVID, as opposed to something else? There's an incentive structure there, right? That's a little misleading, right?
Yeah, of course, and obviously my window of knowledge is narrow, but I think we're seeing this across the country. So, for example, I have a patient that is the manager and runs a nursing home in Orange County. And he came in just last week, and we were chit-chatting about life. And how his business is going. And obviously, these residents are at very high risk. And he shared with me a story that he had an older resident, mid-90s, on hospice for a couple months due to heart failure. And this patient died peacefully. And following the death per protocol of this nursing home and I guess local public health, the patient was tested for COVID-19. And sure enough, this patient tested positive for COVID-19, even though the death had nothing to do with this virus. When the death certificate came out, of course, listed on the death certificate was death as a result of COVID-19. And we're seeing this played out over and over and over again. Of course, this is but one example, right. But if you multiply that by nursing homes all over the country, I think the numbers are way overinflated. And yes, it's true that hospitals are incentivized to code for COVID-19. Now, I don't mean that there's physicians in the emergency room or in ICU that are rubbing their hands together going, well, we can cheat the system and purposely mislead and lie. I don't think that's happening at all. But what I do think is happening is that there's a natural tendency to lean into the direction of that which is benefiting you and your local system. That is, the federal government, other government agencies said, listen, we understand the burden of a hospital system taking care of COVID patients and the difficulty and stress that puts on the system for all of us. Therefore, we're going to reimburse these hospital systems at a higher rate than we otherwise would for deaths due to COVID. But the only way we can track it is some sort of coding mechanism when patients die. So there's this natural tendency, even if you don't have laboratory diagnostics for COVID-19, but somebody died of pneumonia and there were other patients in the same ward that had COVID-19, that there's a natural tendency you want to say, well, you know, if it looks like a duck and quacks like a duck, I'm going to check the box of COVID-19, even though I don't have laboratory confirmation. And I think we're seeing a lot of that going on around the country as well. Sure, there's probably some fraud and abuse also. I don't think most doctors, nurses, hospital administrators are purposely gaming the system, but I do think there's a tendency to lean in that direction in order to get what they believe to be their fair share of reimbursement to compensate them for the hard work and difficulty that's been going on during this pandemic.
Yeah, for sure. I mean, incentive structures pretty much dictate, I would say, outcomes for everything. So there's no, and so this, in my opinion, this topic here is not even controversial. It's the numbers are going to be inflated, even for folks that aren't actively trying to, like, to use your words, game the system. If I have a patient that's passed and has died, and they tested positive for COVID, I'm not going to go spend a lot more time to try to figure out exactly what may have killed them. If I know they had COVID and they died, and I know I'm going to get reimbursed higher, even if that's not my intent and I'm still a very moral person, I would imagine that they're going to just check that COVID box. It just seems to make sense to me. It just seems to make sense. I mean, as opposed to if you flip it on the side where, you know, if you say, for example, just to make a sake of argument, you got, you know, your rate of reimbursement was cut or cut in half or something for the number of COVID cases, and you had the same exact, you know, case where you had a person had died and they had COVID, you're probably going to put more time into figuring out what really caused that death and only check that COVID box if it was actually the cause of death. But that's just human nature. I mean, I think that's just, I really don't think that's that's just and I guess there's nothing they could do there, right? They're trying to help the hospitals, and there's not really I don't know if you do perform deep autopsies on every possible, what are you going to really do to actually make sure those numbers are super, super accurate? I mean, you can only do so much. So,
no, I agree with you. And again, I'm not suggesting that there's, devious people that are purposely lying or misleading. I just think it's the natural tendency by which these incentives were set up to try to honestly reimburse hospital systems for the work that they're doing. And the other aspect of this is we're seeing a lot of coding, not necessarily deaths from COVID-19, but deaths with COVID-19. So people that have underlying disease, and we hear stories of nursing home patients that likely would be dying within the next couple months. Maybe they die a little bit sooner. Maybe they actually got the infection and it just sped up the natural process of what was going to happen anyways. And sure enough, it's another COVID-19 death. Or people that die from something that's unrelated, but it's discovered that they happen to have this virus. They test positive, antibody or otherwise. And of course, they check the box for COVID-19. The reality is what we're seeing, and it's become obvious to me, is that most people that get COVID-19 will have either mild symptoms or no symptoms at all. So you can imagine that if you end up in the hospital from some unrelated problem, but you're tested, and a lot of people have COVID-19 antibodies, and you're tested, and sure enough, you have these antibodies, then it's easy for a hospital or emergency room person or whoever's doing the coding to say, aha, the lab came back positive for COVID-19 antibodies, even though they died of a heart attack, they died of cancer, they died of, pulmonary disease or whatever it might be, that I'm just going to check the box for COVID-19. That then goes on the rolls of another death from COVID-19. And we see these numbers inflate. And now we're over 100,000 and so forth. And so I think that's part of the problem. To what extent are the numbers overinflated? It would be speculation, but it wouldn't surprise me if it's 15 to 20% of these deaths are overinflated and under a normal situation wouldn't be coded as such.
Now, do you personally, does your practice treat COVID patients?
We do. I've treated a lot of COVID patients. Now, I'm primarily just outpatient primary care. So most of the patients I see have very mild and early symptoms. And so I've absolutely treated COVID-19 patients.
And generally, your impression of what COVID's doing to people that you see is what? Is it a relatively benign symptom?
Well, it is. So my personal experience is when you treat it early with mild symptoms, treatment is very, very successful. So I've had enormous success with using the Zelenko method, if you will, and that is hydroxychloroquine, zinc, and zithromax. And when it's used early with mild symptoms, it has been universally effective in the patients that I've treated. Of all the patients I've treated, all have recovered with that protocol, and none have had side effects of hydroxychloroquine that we hear on the news almost every day. And it's been really unfortunate. Vinny, I remember I was driving to work one day. I'm very blessed. I drive down PCH. It's a beautiful drive. I was driving to work. This was now maybe a couple months ago, and I was listening to a press conference, the daily hydroxychloroquine COVID-19 press conference from Anthony Fauci, Bricks, and President Trump. Driving to work, listening to the press conference, and sure enough, that was the first time President Trump mentioned something to do with hydroxychloroquine. I remember thinking, looking at the clock, it was, 10 minutes to 9 Pacific Standard Time. And I thought to myself, what's the under-over of when I get the first text or email from a patient requesting or asking about hydroxychloroquine? Well, it was about 10 minutes. Before I hit the door of my office, I got 2 text messages from patients. Hey, Barke, I heard about this hydroxychloroquine. What do you know about it? And give me a call. And from that point on, hydroxychloroquine was no longer a medical drug that a doctor could use his judgment in consultation with the patient. It was now a political drug that became a hot potato. So for the very first time in my career, I've been practicing over 30 years, I now get challenged by the pharmacist when I write a prescription for hydroxychloroquine. I get called to justify why I am prescribing this drug. It's never happened to me in 30 years. Now, occasionally it'll be a dosing question. Doctor, did you really mean this dose for the drug that you gave? And thank goodness we have good pharmacists because sometimes doctors make mistakes and you meant to prescribe 10 milligrams and instead you prescribe 100 milligrams or something like that. These are mistakes that all doctors will occasionally make. But never have I been challenged. Why are you prescribing this particular drug? Do you have laboratory confirmation of illness? Are you aware of this study or that study that shows this drug isn't efficacious? And locally in Southern California, we have a large medical group known as Kaiser, and Kaiser pharmacies have refused to dispense hydroxychloroquine to their doctors that write prescriptions for this. I've never seen this before in my life. that it's a pharmacy or a medical group that are making these decisions to prevent a doctor from prescribing a medication that has been around since the late 1950s. I mean, there must be literally millions of patients right now that take hydroxychloroquine on a daily basis, similar doses, by the way, that we use to treat COVID-19. They take it on a daily basis for a variety of autoimmune diseases, such as rheumatoid arthritis, systemic lupus, and others, and they do perfectly fine. But yet suddenly, President Trump makes mention of hydroxychloroquine, and now it's a political drug that requires scrutiny and intervention on behalf of pharmacists and others to prevent doctors or to scrutinize doctors that are prescribing it. It's crazy town.
Wow.
I don't understand it, and I think it's bad for medicine, it's bad for patients, and it's certainly not good for physicians.
Now you mentioned, yeah, I mean we're going through a different time. I mean, like you said, pharmacists questioning, an MD's signature and why, and these are weird times. I mean, now you mentioned Fauci. What are your because I was thinking in my head, what if Trump just stayed away from mentioning anything specific and just had Dr. Fauci say these things? What is your general thought on Dr. Fauci? Dr. Fauci, does he have an agenda? Is he legit? Is he on the up and up? What's your?
Well, I've read some of the quote unquote conspiracy theories about him. He's got a patent on this, that, and the other, and it's in his economic interest, and he's going to benefit from the vaccination and so forth. Listen, I think Anthony Fauci is a quality person. He's a good doc, and his role is important. But the problem I have is that we ought not put specialists as the spokespeople for political decisions that need to be made. So here's the example I heard that I think is good. I heard Dr. Larry Arnn, president of Hillsdale College, address this issue, and they just built a beautiful chapel on their campus. And he said, listen, we built this chapel. We hired one of the best architects. We've got a general contractor. We also have specialists. We got the brick guy that's going to lay beautiful bricks in front of the chapel. We've got a drywall guy. We got the marble person. We got the chandelier guy. And we got the person who's going to install the beautiful organ, right? But what we don't do is we don't ask the brick guy about the structure of the chapel and the overall components of putting this thing together. That we talk to the architect and the general contractor. So similarly, it's the statesmen, politicians that should be making the decisions with input from a variety of specialists. We would never put the brick guy out in front of the public to describe what's going on with the chapel that's being built and to be the public figure in the narrative about how we're building the chapel. Similarly, we shouldn't put the infectious disease doctor or the epidemiologist as the spokesperson for the statesman political decisions that need to be made throughout the country. And that's where I think a big mistake was made. Yes, President Trump should be getting input from a variety of specialists with differing opinions, right. And then he and his team should put together the appropriate political response to how decisions are being made. So that's where I think the mistake was made, talking and allowing Anthony Fauci to be the spokesperson for this whole COVID-19 lockdown, et cetera. I mean, if you Google his response, one day he's talking about masks, how they don't do any good, and there's no role for masks to be played for the general population to be wearing them. The next day he's coming out and saying, well, everybody should be wearing masks. So which is it? Similar with the World Health Organization that we know is a corrupt organization. One day they say one thing, the next day they say another thing. And I just don't think it's a good idea to have the narrative driven by specialists. It should be driven by those that are ultimately making the decision.
Mm. Yeah, interesting. So in your opinion, where do we go from here? It's, what's today? June, I don't know, we're in mid-June 2020. Do we just open everything up? Do we continue to slowly do it to avoid a second spike? Do you think a second spike is something that is even worth fearing? The path forward is the same path that we should have taken originally. And that is what a healthy society does is they isolate and quarantine the sick. They protect the most vulnerable,
and they allow the healthy folks to go out and live their life and go about their business. You may remember, Vinny, and nobody actually remembers, but now everybody's doing research. In the late 1960s, 1968 to be precise, there was a massive virus, flu-like virus that went across this country and killed about 113,000 Americans. Population was about a third of what it is now. And so if you account for population, that would be the equivalent of about 130 to 150,000 Americans that would have died. Yet during this time, we held a rally. Maybe you were there. I don't know if you're older than I am. Woodstock, outside of New York, at a farm outside of New York. During this time, Martin Luther King was assassinated, and there were protests all over the country, all over the world. There were also protests for the Vietnam War during this time. So we had over 100,000 Americans die, yet nobody was hoarding toilet paper. We didn't shut down the economy. We didn't shut down the school system. We recovered just fine from this. Now, every death is tragic, of course, and along with it comes grief and mourning for the families, et cetera. And so I don't want to minimize the impact of people dying from this virus or others, but we also have to balance that with the impact of what we've done now in this country in creating 30 million people that are unemployed. I saw one estimate that says 40% of them will not have jobs to go back to. The massive debt that we're now incurring as a result of the government reaction to this, not to mention the political upheaval that we've created as well. And the real harm, I don't mean just the economic harm of people that are unemployed, but the real harm from people's health as a result of the shutdown. Because the shutdown was not just simply let's shut down the economy and stores. And we did so, by the way, in a very arbitrary and capricious way, in my opinion. And we can talk about that. But it was also a shutdown of almost our entire healthcare system. So outpatient care came to a grinding halt. Patients were no longer going to the doctor's office for routine care. I talked to, I've interviewed multiple doctors. Psychiatrist up in LA, for example, reported that he had an 80% drop in his volume. He's an adolescent and child psychiatrist. And so these were kids and young adults that were no longer coming into his office. And these are people that require his care, medication, counseling, just to be functional. Yeah. And repeat this thousands of times across the country. He reported to me that prescriptions for benzodiazepines, and that's Valium, Xanax, Ativan, were at the highest rate ever in his career because his patients weren't coming in, and it was the only way, at least temporarily, that he could help alleviate their panic and their anxiety. I talked to a cardiologist, for example, that said he was no longer doing echocardiograms. He was no longer doing other non-invasive cardiac testing. There was a report out of Ontario, Canada, where there were 50 people that died awaiting cardiac surgery because whatever it was about the cardiac surgery, it was deemed non-essential. So these are folks that shouldn't have died, but did die because the economy was shut down. With it, the healthcare system was shut down. And this is happening all across the country. Gastroenterologists that are no longer doing screening colonoscopies for colon cancer. Gynecologists that are no longer doing screening annual pap smears for cervical cancer, no longer doing routine mammograms for breast cancer. And you can imagine 2, 3, 4 months of shutdown. That's thousands and thousands of patients across the country that where we would have found disease that needed to be treated, but now have not been found. And likely there's going to be long-lasting harm as a result of that.
Yeah, there's no doubt the collateral damage. I mean, I think that's not even up for debate. The collateral damage is becoming huge, and it's going to only get, I would say, more impactful, right, with everything that you just articulated. Now, do you feel, I guess, is this just a case of where we kind of dropped the ball here, and then the response was we kind of missed we screwed up, or was there something intentional? I mean, what do you think, or is it maybe a hybrid of both? I like to think we just screwed it up, but
we definitely dropped the ball. And fortunately, what President Trump did is, the federal government never mandated any shutdown. This was done on a state by state level, And, true with our federalism approach, President Trump allowed individual governors to make decisions that they thought was best for their state. Many governors, including mine in California, governor of New York, New Jersey, et cetera, way overreacted. There were nine states, of course, red states, that didn't shut down at all, and they're doing just fine. So yes, we way overreacted to this, and we dropped the ball. And then commensurate with that also is the mainstream media's natural tendency to fearmonger. And what I mean by that, obviously, you know, in journalism, there's a expression, if it bleeds, it leads. Yep. And so anything scary is broadcast headlines across the front page news. So if a child, for example, dies of COVID-19, it is announced as if it is a common practice, and it scares the you know what out of parents and others across the country. So I think there's some tendency on the left to over exaggerate what's going on, in part because I think they also realize that with the shutdown and the economic collapse and so forth, there's a greater chance that our president will be unelected. And I think there's some truth to that you hear talk about that they talk about COVID-19 is going to be Donald Trump's Katrina. You've heard that broadcast over and over again. And then, of course, as we start to recover from COVID and we get surprisingly good unemployment results and the stock market rebounds, now comes the next phase, and that's the riots. And unfortunately, we've moved on from one national crisis to another national crisis, and who knows what's going to be next. But I'm sure whatever it is will be coming shortly.
Things are opening up. Whether I'd like to look in hindsight's 2020 maybe. I just hope things. Yeah, I'm hoping there's no second surge. One thing I did forget to ask you though. You mentioned herd immunity a few times. That made sense to me from the beginning. It really did. But again, I'm on the outside looking. I'm not in the medical field. I don't track this stuff. What was you mentioned earlier? You thought herd immunity was what we should have went after and allowed to happen. What's the pushback on herd? What has been the other side's, pushback against why herd immunity was not the way to go in this case?
Oh, good. I'm glad you came back to it. I mentioned I would explain a little bit further. So most importantly, what is herd immunity? So it's the idea that if enough people are exposed to an illness and develop protective antibodies, that in turn will help prevent the virus from spreading to the most vulnerable. And that basically is what herd immunity is. What level of protective antibodies do you need in a community to protect the most vulnerable? That's not clear. Some people say 50%, some people say 80%. The most common scenario of how we develop herd immunity usually is through vaccinations. So we're all familiar with the variety of childhood vaccinations, measles, mumps, rubella, polio, tetanus, and so forth. And that's one way we achieve herd immunity, by having a viable vaccine that we can give to a lot of people, so those folks don't get the illness, and therefore the virus, in the case of measles or mumps, for example, can't spread to others. The other way to get herd immunity is through natural immunity. That is, you actually get exposed to the illness and you develop antibodies. I remember when I was a little kid, and this is before we had vaccination for chickenpox, and a kid on the block might get chickenpox, and all the parents would bring the other little kids over to the house so they would get exposed when they were little, knowing that the illness is reasonably mild when you're a kid and potentially dangerous when you're adult. So everybody would gather, and chickenpox is incredibly contagious. Everybody would gather, get their kid exposed, and sure enough, a handful of days later, you develop these little chickenpox bumps, and you'd take oatmeal baths and chamomile and so forth, chamomile lotion and so forth. So that's another way we get herd immunity, by exposing people to it. They develop immunity, and then they are protective because a virus can't jump from them to somebody that's vulnerable. So I do think the path forward with this virus is through some level of herd immunity. And what we've done is we've locked down, we've quarantined the healthy herd, and I think that was a mistake. This notion that somehow before the end of the year we're going to get a viable vaccine, I just don't see it happening. I think probably about this time next year, we'll see vaccinations that may be available. And then, of course, it's going to be interesting to see a vaccination that was rushed to market that has not been widely tested that may or may not now be government mandated, and the pushback that we'll get from people not wanting to stick out their arm for a mandated government vaccination that has not yet been widely vetted and tested. That'll be kind of the next discussion item that will, I think, be very, very controversial.
Well, yeah. Interesting. Well, I mean, at the end of the day, people are really, 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 really jonesing to get outside, to see people, to socialize. It's very, you could just feel humanity saying, okay, enough is enough. Whatever your leaning is, whatever your political belief is, it's just, it's in the air. You can't deny that. So, I don't know. It's scary. It's weird times, but well. So, Dr. Barke, I appreciate your time. Anything else you want to leave the listeners with? Books, where can people find you, et cetera, et cetera?
Well, thanks for asking. I appreciate you bringing me on, Vinny. Yep. I've got an Instagram site at Prescription for Liberty, RX for Liberty. Same thing on Twitter, RX_for Liberty, or you can also find me on Facebook. And to the extent that I'm given an opportunity to try to have a common sense voice, I'm happy to do that, and I look forward to our country getting back to normal and getting on with the business of America.
Amen. Great closer. You saved me some time. Well, Dr. Barke, enjoy the rest of your weekend, and hope you and the family doing well. Stay safe, and I'd like to do this again sometime. Next time the world becomes unraveled, we'll talk about it again.
You got it. Thanks, Vinny. Appreciate it. All right, you take care. Okay, bye-bye.
And that's a wrap. This is Unlatched Mind. We'll catch you next time. See you.